The Centers for Disease Control and Prevention says the opioid epidemic is getting worse. In 45 states, emergency room visits for overdoses are up 30%, and there are virtually no signs of it getting better. Here's Dean Reynolds.
According to the Centers for Disease Control, the nation is in the grip of a fast-moving epidemic for which there are no easy solutions. Illinois is one of the hardest hit states with nearly a 66% increase in suspected opioid overdose visits to the ER last year. Dr. Tom Scaletta is an emergency room physician in Naperville, Illinois, where they treated 500 opioid-dependent patients last year.
You see the carfentanil and the fentanyl as well as heroin and...
Yep, we see a little bit of everything.
Increases in other states across the nation are even more alarming. Wisconsin up 108%, Pennsylvania 80%, Delaware almost 105% in suspected overdoses treated in emergency rooms. Dr. Ann Schuchat is acting director of the CDC.
We saw increases in every geographic region, increases in men and women, increases in all adult age groups.
According to the CDC, overdoses kill about 5 people every hour across the U.S.
The potency and toxicity of what's on the street is very high right now. And so we think there probably is not an increase in people using drugs, but there's an increase in the danger associated with a single use.
Erin Weiner is the director of addiction services at Linden Oaks Behavioral Health.
We know that up to 90% of people will relapse in the first year going through rehab. It's a very difficult problem, and particularly for opioids. The biological pull is very strong.
Do you expect it to get worse?
I hope not.
But there is little sign that the opioid epidemic is slowing down, and emergency rooms across the country are bracing for another night of frantic efforts to keep the victims alive. Dean Reynolds, CBS News, Naperville, Illinois.